Here's the question parents ask us all the time. Does teething cause a fever? Here's the short answer first, because that's the one you want. Teething can make your baby feel a little warm, but it does not cause a true fever. We say this gently because we've sat across from plenty of worried parents who were sure the molars were to blame. Most of the time, the teeth are innocent bystanders. So let's talk about what teething actually does. The genuine signs are local and mild. More drooling than usual, a strong urge to gnaw on fingers and toys, fussiness, swollen or red gums where the tooth's coming in, and sleep that's a bit more broken. Some babies feel a touch warm, but it stays below the fever line. What teething doesn't do is make your baby truly sick. It doesn't cause vomiting, diarrhea, a hacking cough, congestion, or a fever. When a teething baby's also running a temperature of 101 or 102, what we usually have is a teething baby who also caught a virus. If you remember one number from this, make it 100.4 degrees Fahrenheit, measured rectally. That's when we start calling it a fever. We point to the rectal reading because, in babies, it's the most accurate. Below 100.4, in a baby over 3 months who's acting like themselves, a slightly high reading during teething is generally nothing to chase. At or above it, think of it as a fever that needs explaining, not a side effect of teething. Quick timing note, because this is where parents get tripped up. Most babies don't cut a first tooth until around 6 months, and rarely before 4. But the drooling and gum chewing can start at 2 or 3 months, well before any tooth is on the move. So a young baby gets called teething when teething hasn't really started. So here's the rule we never bend. Any rectal temperature of 100.4 or higher in a baby under 3 months is a call us right now situation, full stop. Not because a tooth could be behind it, it can't be, but because at that age, a fever can be the first and only sign of an infection, and that baby needs to be seen the same day. Don't wait it out, and don't write it off as teething. For the comfort part, the good news is that what actually helps is simple and cheap. Cold's your friend. A clean, chilled teething ring, a cold washcloth to gnaw on, gentle pressure on the gum. If your baby's started solids, a cold food in a mesh feeder works too. A couple of things to skip. Benzocaine numbing gels carry an FDA warning because they've been linked to a rare but serious blood condition in young children, so we steer families away from them entirely. Amber teething necklaces are another no. There's no good evidence they help, and a cord around a baby's neck is a real strangulation and choking risk. And if you're wondering about pain or fever medicine, ask us directly, because the dose depends on your baby's weight. So when is it more than teething? Call us if your baby's under 3 months with a rectal temperature of 100.4 or higher, if any temperature hits 104 or hangs on more than 3 days, if there's vomiting, diarrhea, or a rash, or if your baby just seems genuinely unwell. And trust your gut. You know your baby better than any chart does. That's the whole point of drawing this line clearly. Teething is a normal, even if grumpy, part of your baby's first year. But a true fever is your baby telling you something else is going on, and we're always available to take that call. So trust that instinct, and when it tells you something's off, you don't have to sort it out alone. Call us at East Lake Pediatrics, and we'll figure it out together. Stay healthy, my friends.